Good afternoon. My remarks are organized in two parts. First, in keeping with the dream theme, I'll take a deliberately aspirational view of the 21st century in health and describe indicative results of great prospective achievements. Second, as Dean of a School of Public Health in Bangladesh, I'll examine the role universities might play both in leading the global health research agenda as well as in producing the next generation of global health leaders through education of professionals. First, the aspirational view of global health achievements in the 21st century. This view is based on what I believe are the driving values that are defining global health: equity and security. Dr. Bill Foege, a former CDC director and Rockefeller board member, and a true giant in global health in every way, summed up the 20th century in health in 4 words: spectacular progress, spectacular inequities. Projecting forward 100 years, I would hope a similar summing up for health might be expressed as spectacular equity, spectacular security. And I would hope that Bill would be around to express that sentiment. What would such a transformation in global health equity look like? It would mean transcending the tendency of health systems towards greater inequities in health outcomes, what Julian Tudor Hart famously called the inverse care law, and learning systematically how to break the law, the inverse care law. Across the life course, breaking the inverse care law would yield the following outcomes by 2113. All first trimester terminations of pregnancy are gender blind, and the world's 2 most populous nations achieve normalization of sex ratios at birth. Maternal mortality declines to the point that the World Health Assembly debates whether it should be declared eliminated or eradicated. That debate will take a century in and of itself. Improvements in gender equity in health are of such magnitude that the New York Review of Books publishes an article in 2090 entitled "Zero Missing Women" on the centenary of Amartya Sen's 1990 article entitled 100 million missing women. Survival and early child development opportunities for children are equal in all cities in the world, be it Beijing, Bangkok, Bamako, Berlin, Baltimore, or Bogota. Risk factors for non-communicable diseases, including tobacco use and obesity, are declining at similar rates for the wealthy and the poor in all countries, in part because the tobacco and junk food industries are nearing extinction. And there is universal access to effective prevention, treatment, rehabilitation, and palliation of chronic illness. In terms of spectacular security, outcomes might include a one world health system for pandemic threats that ensures a 24-hour, 7 days a week, 365 days a year, global capacity for detection, speciation, development of, and access to drugs and therapies that constitute a rapid and effective response to disease outbreaks without social and economic disruption. All countries will have progressive health financing systems that minimize direct payment for health care for its citizens at home and abroad, and healthcare expenditure will be eliminated as a threat to household economic security. There is freedom from hunger, homelessness, and the stigma of mental health. Safety checklists in hospitals and other innovations relegate medical errors from a leading to an extremely rare cause of death. And all individuals have living wills that guarantee dignified end-of-life care that respects individual choice. What is the role of the university in achieving this dream for global health? In his commencement address to the students at Harvard University in 2006, Bill Gates Jr. said that reducing inequity is the highest human achievement. And the development economist Paul Collier, in his best-selling book, The Bottom Billion, said that although the plight of the bottom billion lends itself to simple moralizing, the answers do not. The university, thus, has an important leadership role in marshaling knowledge through both research and education to achieve this dream for global health equity and security in the 21st century. Leadership in research involves not simply engaging on priority topics. It requires breaking frontiers and establishing new types of information systems, disciplines, and fields that are more responsive to the nature of global health equity and security challenges. In Bangladesh, the IT revolution in health is opening up opportunities for continuous, lifelong, portable electronic health records based on unique bibliometric identifiers assigned at birth as part of universal vital events and health information systems. If this can be done in Bangladesh, why can't it be done globally? Why couldn't every newborn be assigned a global health identification number, or GIN? Think about the equity and security benefits of counting every life and making every life count. The knowledge of what determines health has grown exponentially and spans the biophysical, including genomes and proteomes, to the cognitive and behavioral, to the social, structural, and environmental. And just as Warren Weaver, the Rockefeller officer who catalyzed the emergence of molecular biology in the 20th century, there is now a similar opportunity ahead to combine the power of epidemiology with demography and economics and create a new hybrid discipline that I like to call epideminomics. Epideminomics could shed fundamental insights on the diverse range of interactions of health determinants through new age, multi-level, transnational research designs where the sampling frame comprises a cool 10 billion individuals. In addition to this gin and epideminomics cocktail, an exciting new field of health systems research is on the knowledge development menu for the 21st century. To effectively prepare and respond to a global pandemic, and to scale up interventions to save mothers and children from preventable mortality, and to provide effective secondary prevention in the community for hypertension, diabetes, and high cholesterol. It requires a level of functioning of systems for health that is all too often missing. Learning to do better and achieving breakthroughs in systems performance is whetting the appetite of a group of researchers and practitioners from diverse disciplinary backgrounds and contributing to securing the scientific foundations of a new field. In 2113, a review of Nobel Prizes granted in health in the last century will show that the majority have been granted to health systems researchers from non-OECD countries. Just as the knowledge agenda related to research needs leadership, so too does the education agenda related to health professionals. On the 100th anniversary of the landmark Flexner Report on medical education, the report of the Global Commission on Health Professional Education for the 21st Century recommended a set of instructional and institutional reforms to achieve transformative and interprofessional education for equity in health. These broad recommendations are helping to reset the direction and revitalize the relevance of health professional education globally. In following up in Bangladesh, we have reformed our Masters in Public Health around a praxis theory of knowledge for public health. Praxis is defined by Paulo Freire in his book, Pedagogy of the Oppressed, as reflection and action upon the world in order to transform it. The theory draws on 4 core domains of knowledge that are relevant to every public health problem and includes 5 generic types of learning: values and ethics, concepts and frameworks, methods and measures, tools and instruments, and leading and managing change. Rather than bore you with the details of how we are oppressing our students, I thought it would be more interesting to hear from them directly. However, 20th century technology conspired against me. While you can visit our website to hear the inspirational voice of our future leaders, I'm sure you would be impressed, as I am, of their borderless and optimistic vision of the future. They have unbounded energy to bridge traditional disciplinary silos and to go to the people public health is meant to serve, to learn from them, to work in dream teams, to learn from one another, to work hard, and above all, in their words, to have fun. Clearly, the spirit of sacrifice and service that Mr. Rockefeller hoped for nearly a century ago at the inauguration of the Peking Union Medical College is alive and well. Further commitments to nurture and grow the people to lead will set us on the right course to realize the centennial dream of spectacular equity, spectacular security. Thank you very much.